It's my pleasure to introduce the next speaker, who is Dianne Neumark-Sztainer from the University of Minnesota School of Public Health, to talk about to diet or not to diet, preventing weight-related problems in adolescents.
If people want to get up and stretch a little, because it's kind of hard after. Yeah, there you go. And feel free to do that throughout the talk.
You wanted to do bigger?
That's fine. Otherwise, that's good. That's good. Thank you. So thank you so much for having me talk today. It's been so interesting to listen to the talks, and I've been thinking about things at a personal level and a professional level. I've been thinking about the first speaker and how the whole thing with the rewards may explain some of our results, and the second speaker, I was thinking about my husband and my differences in retirement accounts, and the third one, I was finally so glad to get an understanding of behavioral economics, because we had a reviewer once who said we should do behavioral economics, and I had trouble understanding what it was. So thank you. And I guess what I would suggest is also with my talk, this, for some of you, this may be your area. For many of you, it probably isn't. I imagine that everyone here has either been on a diet or knows someone who has been on a diet. So I invite you to think about this also at a personal level and a professional level, and then to share some of those thoughts in the discussion, because for me it's great to get people's perspectives who come from a slightly different area. So the question is to diet or not to diet. And we're going to be looking in particular at adolescents. And I'm going to be addressing these questions. How common are dieting and unhealthy weight control behaviors in young people? How effective are these behaviors for long-term weight management? Why dieting might not be the solution? That's kind of a what do you call that when you give away the end? What's that called when you review? What is it? A spoiler, yeah. Okay, and if not dieting, then what? Our data are from Project EAT, and Project EAT is really a series of studies aimed at learning more about eating, activity, and weight-related outcomes in adolescents and young adults. Our study has been conducted in Minnesota, and I thought I would just take a few minutes to talk a bit about our different studies. And we were talking about this a bit at lunch with our group. When I embarked on this research originally, we were funded, it was probably about 1996, 1997. I was a new assistant professor in my department. And going through the literature, realized that there was not much out there about the types of factors influencing adolescent eating behaviors. There was a lot on adolescent pregnancy, a lot on substance use. There was a lot on nutrition during early infancy and pregnancy and later adulthood. But people weren't really that interested in adolescent nutrition. In fact, the chair of my department, when I was a PhD student, said that would be too narrow a field to go into. And then, with everything that happened with obesity, people started getting interested in this area. So we embarked on this study. It was originally a cross-sectional study, and we surveyed about 4,500 adolescents. We had a good survey. The topic got interesting. We ended up going back 5 years later, and we were able to find about half of our sample. So my first piece of advice that I always give people is always pretend it's going to be a longitudinal study, because you never know. But we didn't have good contact information. But since that point, we have followed our sample very carefully. We track them every year, and we have had good follow-up. So we followed them in EAT-2 5 years later. So we began, they were junior high school, so between about the ages of 11 and 16. We followed them for 10 years, every 5 years, and we've just been funded to follow them for another 5 years, and also to follow their pre-adolescent and adolescent children. So it's a really nice group. And then we have this new cohort, EAT 2010. This was a new study of a new cohort of adolescents in the year 2010 who who we recruited so that we could look at 10-year secular trends. During this past decade, where there was a lot of emphasis on obesity, how have things changed for youth? And we used more of an ecological model our second time around. First time our study was driven by social cognitive theory, and with more and more attention that's being given on the environment. So we surveyed 2,800 adolescents, population from very diverse backgrounds, and their parents, their mothers and fathers. We surveyed them in 7 languages. Their peers, they wrote down their best friends, and if they were in our population, we had data on their peers. We collected school data and neighborhood data. So we're really able to look comprehensively at the types of factors influencing their eating behaviors. We brought in to look at physical activity and weight status. And now we're trying to follow this group longitudinally because now we do have good data. It's kind of the Cadillac version of what we did before. Anyway, that's where we're at. That's kind of our global study. One of the unique pieces of our study is we're really looking at a broad spectrum of weight-related problems. So not only at obesity, but I've been really interested in body image, disordered eating disorders, although we don't do a good assessment of clinical eating disorders, but really looking at disordered eating attitudes and behaviors. But today in my talk, I'm going to focus on dieting. And the question is, why focus on dieting? And if you live in the society, you know that a lot of money is being spent trying to persuade people to go on diets. So I just wanted to go through some of these ads. Yeah, it's a big seller for books. Lots of promises. And if you do these diets, this is how you will look.
So where are all the guys in those pictures?
Yeah, good question, huh? It's very interesting. So I will show you some of the numbers. We do see now that there is more focus on young men, and I'm not actually going to show you those data, but we have collected data on muscle enhancers, which we see among young girls and young boys. Interestingly, when this study, and I'm sure some of you have this, when they go to the media, the studies that get picked up by the media, you never quite know what's going to happen. But the media was interested in the boys. And it got me so mad because this has been happening with girls for years. So anyway, we can talk more about that. Okay, so how common are these behaviors? Given this environment, given all the pressures to be thin, what did we find? And I'm going to be showing you data from the 2010 sample. This is a bit on the sociodemographics of our population. So you see it's about 80% non-white, so very diverse sample, half male, female, middle school, high school. Oh, okay, first I need to show you how we asked about this. So first of all, how we ask about dieting. And this is always a question, how do you ask about it? So you could try to answer this for yourself, because it's good to kind of be thinking about this. How often have you gone on a diet during the past year? By diet, we mean changing the way you eat so that you can lose weight. And then those are the different responses, and we dichotomize them. And we really leave it up to the young people to define how they diet. And then we ask about specific weight control behaviors. Have you done any of the following things in order to lose weight or keep from gaining weight during the past year? The first 5 methods are categorized as unhealthy in some of our analyses, and the last 4, diet, pills, vomit, laxatives, diuretics, are extreme. Sometimes we put them together. Originally, we also used the same question, and we included healthier behaviors. And we had to change those items when we went back with our new study because so many people say they use the healthy behaviors. Okay, so again, you can kind of look at that, see what you might answer. So what did we find? We found that nearly half of young girls, of adolescent girls, and a third of boys engage in dieting behaviors. Similar numbers engage in the unhealthy behaviors, and a much smaller number, but a concerning number, engage in the extreme weight control behaviors. So just to remind you, these were the unhealthy ones. Fasted, ate very little food, used a food substitute, skipped meals, smoked more cigarettes. About half of our girls and a third of the boys are doing those. So there's the answer to your question. Definitely a concern among boys, not as much as we see among the girls. So then the question is, how effective are these behaviors for weight management? And I was interested in this question because we know that these behaviors are strong risk factors for eating disorders. We know that the strongest risk factors for eating disorders are dieting and body dissatisfaction. But what about obesity? Are they actually effective in preventing obesity and in preventing weight gain over time? So this is the citation for the article that was published. And specifically, we wanted to see, do dieting and unhealthy weight control behaviors predict changes in body mass index? Body mass index is just a measure of weight to height. Over a 10-year period from adolescence to young adulthood, and how do associations differ when dieting and unhealthy weight control behaviors are persistently reported as compared to when they are discontinued or initiated halfway through the study period. And I'll get into why we wanted to look at that when I show you the results. This was our sample, about 774 males, 940 females, and you can see who we excluded. And this is what we do because of our attrition. We use a response propensity weighting method, and please do not ask me any questions about that, but I will say that it basically brings our sample back to have the similar characteristics as our original sample. So we know we didn't lose people, we lost more non-white people than white people and things of that nature. So this is what we used here. This is from our longitudinal study, obviously. Body mass index was based on self-reported heights and weights, and we look at the change between time 1 and time 3. Now, we did have, at the beginning, we measured heights and weights, but we didn't do that as we went along with our study. So at the beginning, we had self-reported and we had measured, and then at time 3, we did a sub-study on the self-reports and the measured heights and weights, and we actually see a very, very strong correlation between them. There is an underestimation, but the numbers are actually very highly correlated. And these were our 4 comparisons groups. So we have no use. They did not engage in the dieting or the unhealthy weight control behaviors at either time 1 or 5 years later at time 2. We had the starters. They were not doing the behavior at time 1, but they started 5 years later. We had the stoppers who were doing the behavior at time 1, but not at time 2, and then we had those who were persistent. We don't really know if they were persistent, but we know they were reporting the behavior at time 1 and time 2. Okay? And these were our analyses, what we adjusted for. So what do we find? What do you think? Okay, well, first I'm going to show you the prevalences. So again, going back to the question in the back, these are the boys in our study. We see that about 60%, 50 to 60% fell into the didn't use any of those behaviors. About 10% engaged in dieting persistently, and nearly 20% engaged in the unhealthy weight control behaviors persistently. If we look at the young women, the girls, we see much higher percentages of the persistent use. You can see it's about 40% engaged in these behaviors at both time points. And here we have the unhealthy weight control behaviors and the extreme behaviors combined. Pretty much everyone who's doing an extreme weight control behavior is also doing an unhealthy weight control behavior. And these percents are percents of youth using any behaviors in that category. Yes. Yes, and we've looked at our data in different ways, using as a continuous variable. It works the best this way, but many reviewers ask us about that, so it's a good question. Okay, so what did we find? So I'll walk you through this slide because I'm going to show you a few more like this. Is this a pointer? No. Okay. So can you hear me if I walk away from the mic, or is that? No. Okay. So these are changes in body mass index. It's fine. We can manage. It's fine. These are changes in body mass index over the 5-year period. So for those of you not familiar, oh, great. So what do I do? Oh, cool. Okay. So BMI unit, so about one BMI unit is about 5 to 6 to 7 pounds. It kind of depends. So figure 3 BMI units, that's about 15, 16, 17 pounds, okay? So among the boys who did not engage in dieting behavior, over the 10-year period, their BMI went up by about 3.5 units. And these are boys going from age, let's say 15 to 25. So we expect some change. But look what happens to the boys who diet. Their BMI goes up by nearly 7 units. And this is adjusting for their time 1 BMI. So it's not just that they were fatter kids to begin with that are on a trajectory for greater weight gain. So they've chosen to engage in this behavior with the aim of weight loss. And in fact, their weight gain was really double if they hadn't engaged in this behavior. It's a huge difference. And I want to stress this is a huge difference on a population-based study. You never see things like this if you look at fruit and vegetable or physical activity or breakfast intake. Partly it's a measurement issue, but something we need to be paying attention to more. I should just explain, these are the p-values explaining, comparing with the non-dieters, and then these little superscripts here are comparing to each other. So those who stop dieting, they have an A and this group has C, so these two numbers are statistically significantly different to each other because the superscripts differ. Okay, this was why I wanted to do this analysis. We already knew from previous analyses that people who diet gain weight over time. But the question I always get asked, no one wants to believe these data, and you're probably looking at them thinking, well, maybe it's this or this or this. People said, well, maybe these are people that should be dieting, because if they weren't dieting, maybe they would have gained even more weight. So we wanted to see, well, what happened to those people who actually were dieting and then they stopped? And what we see is they did not gain more weight than this group. In fact, they gained less weight than that group, okay? Now, there could be, this is kind of a beginning analysis. It brings up many questions, but nevertheless, the findings, I think, are quite important. This is what we see for unhealthy weight control behaviors in boys, young men, I should say males, because they're really going from into young adulthood. Very similar pattern. If we look in the young women, again, we see a similar pattern, although here these two numbers are not statistically significantly different to each other. Nevertheless, the stoppers are certainly not gaining more weight than the persistent dieters. It still trends toward being less, although not statistically significantly different. And similar pattern for unhealthy weight control behaviors. So we concluded from this study that dieting and unhealthy weight control behaviors are very prevalent, particularly among young women. Persistent use of dieting and unhealthy weight control behaviors are predictive of large weight gains over time. And in no instances was stopping dieting or stopping unhealthy weight control behaviors predictive of greater weight gain than the persistent use of the behavior. So this is the next question, or this was we've had this question all along. Why? Why is this happening? And you probably have some ideas, right, as you're listening to this. So I'll tell you, my example is I was writing a book on this topic, which I'll show you a little later, and we went out for dinner with some friends, and it was a pizza restaurant, and the guy said, like large, medium, extra large. He says, I want extra large because I'm starting my diet on Monday. That's kind of the typical thing that we see. Okay, so let's just imagine that you haven't just had a beautiful lunch and you're hungry. It's, maybe it's 5 p.m, and you're invited to a tea party, and there's beautiful tea and beautiful cake, and then you remember that you're on a diet. How do you feel? What happens when you go home? Okay, so just kind of envision the situation. So we've tried to look at this, and this is an analysis from our 5-year data. We actually haven't done this from our 10-year data, and we should, because we could do it better than we did it here, because we'd have 3 time points. So what did we do? We're trying in some way to get at why is dieting related to a change in BMI, and is it mediated by these behaviors here? So is it due to behaviors or not? So let me take you through this. So we found dieting at time 1 was predictive of more binge eating at time 2. If you dieted at time 1, the dieters, you were almost 9% more likely to binge eat. It was the difference. It was a 9% difference, right? So it was 9% higher, okay? So dieting definitely seemed to predict binge eating over time. And binge eating, here we had to look at the same time. Well, no, this was time 2 and then change overall. Binge eating is predictive of an increase in weight gain over time, and we know that from many studies. We also found that dieting was associated with less frequent breakfast consumption, and in this study and other studies, we know that skipping breakfast is associated with weight gain over time. It's actually, so we're seeing the dieters are actually engaging in more binge eating and less frequent breakfast consumption, 2 behaviors which are predictive of weight gain over time. So you would think the dieters would be eating more fruits and vegetables, but actually they're eating a little less. It's not statistically significant, but they're certainly not eating more fruits and vegetables, and they're definitely not engaging in more physical activity. There's absolutely no association there. So then we looked at this number, and I don't have the number to show you, but we wanted to see, I think the association originally was like, without these mediators, it was maybe 0.69. I can't remember. So it goes down, but it still remains, okay? So we see a partial mediation here. Once we adjust for binge eating, breakfast consumption, fruit and vegetable intake, and physical activity, the association between dieting and change in BMI is significantly reduced, but it remains statistically significant, suggesting that this is not explaining the whole picture. Something else is going on. Either we didn't measure these behaviors well, there are additional behaviors, there's a genetic predisposition, and it's probably, or some other, it doesn't have to be genetic, everyone's genetic, that's like the big thing now. But something else is going on, okay? And that's why I say, we're doing this work, we have some very convincing data, but definitely many questions remain unanswered. So this is another question. What is meant by dieting or going on a diet? So when I asked you at the beginning, have you been on a diet? How did you answer? And if anyone wants to respond, they can. I don't want to put anyone on the spot. Not honest. That was honest. Meaning? You have been one, okay. I wonder if that was honest, that you've only been on one. Okay, yeah.
I was confused, or it's a question I have between, going on a diet versus sort of, I'm going to try to eat healthier because
Right.
I'm not feeling very good, or I'm going to try, like that distinction.
Right, and that is the distinction. So if you would ask me, have you been on a diet in the past year? I would say no. But if you said to me, have you paid attention to what you're eating because you're thinking about your weight, you're thinking about your health, you're thinking about your energy, I would definitely say yes. And of course, we're talking about adolescents here. So, it's just the whole thing. This isn't adults, it's adolescents. Would it be different in adolescents and adults? It's really a question mark. We don't know. We chose to leave it fairly open this is what I think is going on when people say they've been on a diet. It's an eating plan that includes rigid rules about what to eat, how much, in what combination, or at what times, that's usually followed for a specified period for the purpose of weight loss. I mean, okay, that's, pretty specific definition, but it's kind of like I'm going on a diet, and I know at some point I'm going to go off my diet. As compared to, if not dieting, then, I'm going to skip that. Okay, as compared to what we call healthy weight management, eating and physical activity patterns based on general guidelines that are adaptable to different situations and practical on a long-term basis, which is kind of what you're getting at. So, I'm trying to make healthy food choices, but if I'm traveling, I'm going to eat differently. I'm going to eat more sometimes. I'm going to eat less sometimes. I'm going to enjoy it when I eat a piece of cake. I'm not going to feel guilty. We just, actually, I was looking at my email before I admit it, and there was a woman who wrote the book Teenage Wasteland. Abby Allen is her name, and she just wrote an article in the New York Times that came out, and she had interviewed me for it. So I was reading the comments that people wrote. It's so interesting to read the comments that people write on these things because it kind of gets you into the real world and how people are saying how really they dieted themselves to becoming overweight and the kind of the thoughts that went through their mind. So this does not sell books. It's not all that exciting. We all kind of know this. It's harder to do, and there's lots of good thoughts here about how to get people to do this. But it's so intriguing to me, and with the background that's here, is why do people decide to go on a diet? Even though so many of us know that most of the time the diet isn't going to quote unquote work. And what is it that drives people to do that decision? And that's why I want to come out with these data and show people and let people know that it isn't the way to go. This is a study where we looked more broadly at what predicts overweight over 10 years. Can you even read this? Basically, we looked at a whole bunch of stuff to see what does predict incidence of overweight over time, and the pluses are showing protective factors. The minuses are risk factors. Oh, yeah. Okay. So this is overweight incidence at 10-year follow-up, young people who became overweight. So, for example, whole grain servings, if you ate whole grain servings, there's a plus there. That means it was a protective factor. For F, for females, vegetable servings was a protective factor in male. Breakfast frequency was a protective factor in females. And then we get into everything that I just showed you, the dieting, the unhealthy weight control behaviors. Those were risk factors. And what I want to show you is some of the things here that we have seen over and over again in our analyses, looking at it different ways. Things in the family, like talking about weight, encouraging children to diet, teasing, or we should say bullying, but we've used the word teasing. So making hurtful comments about weight. This happens a lot in families, and it doesn't always happen with the intention to hurt your child. Often it's made it's either just kind of joking around or hoping that it will motivate children toward losing weight. It's actually a very strong predictor of weight gain over time. So this body of research has really pointed to the fact that when we're talking about obesity prevention, we really need to be talking about these behaviors and this atmosphere, which also increases risk for eating disorders. So what do? We want to recommend starting the day with a healthy breakfast. We had a beautiful breakfast here today, eating lots of fruits and vegetables. There's been a lot of emphasis on drinking drinks that do not have calories in them, like water. we've done a lot of work. This is a whole body of research that's come out of our study on family meals that has been fascinating. And the most fascinating thing was how people have responded to it, because it obviously touched a nerve. And we just started with this. We did focus groups, and people talked about the differences in their home. And we do see that family meals are strongly predictive of disordered eating behaviors, particularly in girls. The associations with obesity are a little less consistent, and that's something that we're looking at in more depth, trying to get at what people are eating at family meals. But it's just beautiful, isn't it? Here, this is an Israeli family, because there's some Israelis here, I know, right? This is my family. Unfortunate that it's coming with all the alcohol after that previous talk. But it was New Year's, so okay. I have to get a new one, I think. Okay, this is, the whole idea of being physically active not for the sake of weight loss, but just for the sake of feeling good, environment, whatever you want. And actually in Minneapolis, we have wonderful bike trails. I actually can bike all the way to work on a trail when it's nice out. Attention is being given to the whole idea of intuitive eating. I would say the research in this area is weak to moderate, just kind of beginning. The whole idea of paying attention to whether I'm hungry or I feel full. And some people will argue that's impossible to do in the society that we live in, where there's so much food and the types of food that we're exposed to. But it's definitely an area that is of interest. So I have actually become very interested in yoga. I just came back from a year-long sabbatical, and I did my 500-hour training as a yoga teacher. And I'm really interested in the link between what this might offer to eating disorder prevention and obesity prevention and just feeling better about your body, and building on this whole idea of, by getting more in touch with my body, will I be more able to identify signs of hunger and satiety? So it's just kind of a beginning area of interest of mine, and those of you who do yoga can probably relate to that. So just in closing, I have 3 more slides. One is on some recommendations for parents and for healthcare providers, and then just a website for a program you can go to. So, parents, if you're a parent, if you've had a parent, all of you have had parents, it's really hard in today's society. You want your children to be at a healthy weight, but you also want them to feel good about themselves. And some kids, it's not even an issue, and some kids, it's more of an issue. What do I say? What do I do? So we really try, and we're actually very dedicated to this with Project E, to bring our findings to the public. And so these were some of the recommendations that, this was actually from my last sabbatical leave. I wrote a book on this topic for parents, and these were the recommendations to model healthy behaviors for your children. And, of course, what does healthy behaviors mean? Well, to everyone it means something different. But to me, it really means, you've kind of gotten the idea already. And some of the things are, have a piece of cake and just say, I enjoyed that piece of cake, instead of saying, oh my God, I feel so stuffed, why did I do this, Provide an environment that makes it easy for your children to make healthy choices. So really, that's the main piece of advice I'll give parents. Talk less, do more. Talk less about weight, do more to make your home one where it's easy to make these changes. In our society, people tend to do the opposite. We talk a lot about these issues, but maybe don't do enough. Focus less on weight, instead focus on behaviors and overall health, and provide a supportive environment with lots of talking and even more listening. That sometimes can be hard with adolescent children. Who did you say before? They get sulky. Yeah. So I have 4 young adult children now, and so they went through adolescence. It gives you a whole different perspective on looking at data, doesn't it? It's much more very humbling about the cause and effect and what's going on. But we interviewed overweight adolescents, and they, it's so hard to be an overweight adolescent. And they talked about the support that their parents gave them and just being there for them and how much they appreciated that. Oh, that's my book. Okay, recommendations for healthcare providers. I'll just quickly go through these just to give you a sense as to what we recommend what we use these data to recommend. One is to inform adolescents that dieting, and particularly unhealthy weight control behaviors, may be counterproductive to the aims of weight maintenance over time. Do not use body dissatisfaction as a motivator for change. Now that probably comes as no surprise to this group, but you'd be surprised. Some people think that people aren't motivated to change because they're just okay with their bodies, and we've actually seen in our data that it's the opposite way. Youth who feel worse about their bodies gain more weight over time, even after adjusting for baseline weight status. Encourage families to have more family meals, encourage them to talk less about weight, and assume that overweight teens have experienced weight mistreatment and address this. Most overweight youth have experienced some type of weight mistreatment, either direct teasing, exclusion from groups, and I think it just needs to be talked about. And young people need to know that it is not okay. Even if you can't change that situation, they need to know it is not okay, because they often think they deserve it. So this is the website. You can go to this website, www.newmovesonline.com. And if you want to see how we've used some of these data to guide a behavioral intervention, this was a program that we did with adolescent girls in high schools. We offered it as an alternative physical education class, and we really tried to get young people to feel better about themselves and their bodies to implement healthier change. And it's just, the materials are really fun. They're very adolescent appropriate, and they're free for using, the surveys and everything. So with that, I will close and love to hear what you have to think.
Hi, very interesting and obviously very relevant to today's world of adolescence. What relationship do you think, I know you talked about this a little bit, but if you could extend it more, in between risky decision-making of the sort that, say, economists study or that psychologists study, and food issues? They're the same, but they're different. I mean, there's overlapping things, as you alluded, but how are they different versus the same? Temporal discounting is obviously related to both, but what about risk preference and that sort of?
Okay, first of all, I am not a psychologist. I don't even know what temporal discounting is.
Delay discounting, like the previous speaker talked about.
Okay.
You can have $10 today, you can wait a week, and you get 20.
Got it, yeah. We were talking about this at lunch. Mark was talking about this, so he may have some things to say. And as he was saying, it's kind of been looked at differently. So often we'll look, and we have done some studies where we've looked at the covariation of behaviors, so how do behaviors fall together. I would say that mostly it's been a separate body of research. Probably there's been more research looking at the unhealthy dieting or the extreme dieting and some of the other types of behaviors. In terms of the eating behaviors, I would say it's been pretty separate. So I think there's definitely more room for putting them together. One of the big differences, of course, with the eating is that we all need to eat. And so people talk about it a lot with, people will ask, is there such a thing as food addiction? I don't know if anyone's going to ask that, and I don't actually know the answer to that question. Some people will say for sure there is. I probably a while back would have said no, and now I'm not so sure. I'm kind of leaning toward maybe there is, but it's definitely different to substance addiction because you can't stop eating. You need to keep eating, so that's a big thing. Not sure if I'm exactly answering your question, but. Speak up, whoever.
So one alternative explanation that you didn't mention, which came to my mind, is suppose that we had as the outcome variable just general health, and the dependent and the explanatory variable was visits to the hospital. And we would expect to see that people who visit the hospital more are unhealthier. People who have persistently gone to the hospital are unhealthier. People who went to the hospital and stopped going to the hospital are now healthier. And people who started going to the hospital are now unhealthier. And so there's this kind of a reverse causation that could be explaining this pattern of results, because dieting is not kind of this random thing that falls from the sky. People choose to diet in response to something. And so it seemed to me that one way that we could kind of get at this issue is there have been thousands of studies now run, kind of randomized studies on dieting, where there's a control group and then there's a treatment group that is assigned to follow a diet. And then the researchers follow their weight kind of for a period afterwards. And is it the finding that across many, many studies, people who are in the treatment group who are assigned to diet subsequently become heavier than the control group, or do they kind of end up at the same place? My impression had been that they actually end up at about the same place, which leads me to wonder how much of the extra weight gain that you observe among adolescents who diet is really caused by the diet versus some other unobserved factor.
Yeah, I mean, and I don't know. So I have a few thoughts. First of all, with your first analogy that you gave, were you adjusting for initial health status with the visits to the hospital?
I mean, that wouldn't help us, right? Because you have adjusted for initial weight, but suppose as I move along in life, I discover that I'm getting heavier and heavier and heavier.
Yeah.
Well, that's going to motivate me to diet more and more and more.
Right. Yeah, I mean, it would be much better if we had shorter intervals between our data collection, because then we could actually look at it a little bit better. When I look at this and I try to draw a conclusion, I bring our data together, I bring other data together, and I bring with the experiences of people. And I can tell you, when you talk to people who have done this dieting cycle, they tell you, I dieted myself to becoming overweight. Now, that may not sound very scientific, but when it collaborates together, I think we're getting at something. Now, when we look at the studies of the dieting versus the non-dieting, and some people will say, well, why don't you do a randomized control trial to look at this? And I think there is a difference, because when you look at groups who are assigned a diet versus a non-diet, it is it's usually, how should I say this, a good diet. It's usually more of an eating plan than a diet. Whereas this is what young people are choosing to do. You're never going to go to a group and they're going to tell you, okay, for the next week, just eat bananas. Do you know what I mean? So we're there. I feel like this is a situation where it actually might be better to be doing a population-based study than a randomized control trial. And that's not exactly what you're asking, but it's just what I'm thinking about. But I think your points are certainly valid. And I'm actually trying to figure out how we could get at that with our data or with another study. So I'm really open to hearing your thoughts on it. Maybe we can talk later.
I have a question, whether you've ever looked at the moods or emotions that people have, because one possibility is that going on a diet puts you in a bad mood. And so that's not a positive thing, and it's likely that more eating results from trying to then battle the bad mood that the dieting in the first place has induced. Do you have any hypotheses, or is there any data on emotion?
So I definitely think that's true, and I definitely think that's probably why we're seeing or at least partially why we're seeing why the dieting predicts the binge eating. And we could actually look at that also with our again, we'd have those 5-year intervals, but we do have some measures of depressive symptoms that we could look at. That would actually be a nice analysis. Yeah.
So a related question. Yeah. When you're to me, one of the most interesting things is, as you outlined, what are the mediators of the dieting to the weight gain or other negative outcomes. And you've certainly looked at some. But I'm wondering, if you imagine it's the restriction, if you imagine it's the high structure or the body's dissatisfaction, what about some natural experiments like kids who observe Ramadan, who naturally, repeatedly restrict and fast for long periods of time? I mean, some of the models would predict that. Or kids that are wrestlers who starve themselves periodically for restriction, but for different reasons. And I'm wondering if you've tested features of the model in other populations that may be addressing components of the behavioral patterns for adolescents that could lead to these negative outcomes or negative trajectories that may be separable. I'm just wondering, I'm sure you've thought about many of these, and I wonder if you have any comments or observations.
Yeah, no, I actually think that's an interesting idea. And we do actually have from time one, we did look at specific sports, so we could look at the wrestlers to see what happened with them over time. I mean, it would partially get at that. It's an interesting question about the fasting for Ramadan, and I wonder if I'm not aware, are other people aware of research that has looked at that? I know what I'm like the day after Yom Kippur. Yeah, I like that idea. Yeah, and we could do that with with some of our cohorts, because we haven't. Yeah, thank you. I have to write down these ideas. Yes, or whoever is. Oh, okay.
So every once in a while, you meet someone who's gone on a diet and they've had a really good outcome, and they've lost weight and they feel good and they're happy and they have a great story, like their knees don't ache as much and and their marriages are better and all that, and so it seems like the diet. And doctors are always telling you to go on a diet. So, I mean, it seems like it could have a good outcome. And so I would guess that in your sample, if you look at the mean data, I'm not arguing with that, but there's probably a subset of those teens who had a successful diet. And maybe, and maybe it wasn't that they just were more mindful about what they ate, but they actually did something that kind of worked for them. And I was wondering if you broke those out, if there might be some interesting insights, because the take-home message from your talk is really that dieting is bad, but dieting is a very heterogeneous thing, I would guess, and as is the psychology that goes with it. So do you have any sense of there's probably a bunch of dieting stars in there and with good outcomes, and what happened with them? And
So first of all, I just want to say that, yes, I think that probably is what drives other people to go on diets. It's like the lottery or something. There's this hope out there that you might, even though you're not really supposed to, they say it's for people that failed in math, right? But so one of my colleagues, and it took the lead on a paper from another data set looking at successful weight maintainers, losers. It's very difficult because our population is growing. So with adults, it's very easy. You can look at weight loss. But with young people, deciding who has been successful, it's a little trickier because some of them, because sometimes it wasn't a matter of, I don't know why it got so complicated, but it's a matter of some of them lose weight, some of them are growing, so they're maintaining, and so those kinds of things come into it. Nevertheless, we did do this one analysis looking at the predictors of successful weight maintenance or weight loss over time. But that was the predictors, and I don't know how informative it actually was. And I'm trying to remember because she wanted to do this with this data set, and for some reason that paper never came to fruition, and I'm not quite sure why. And we could definitely revisit it, particularly now that we're looking at our young adults and there's less growth going on. So you'd want to know who were the people that succeeded or what they did, both. Yeah,
both are
yeah, yeah.
it's like
Yeah.
sometimes if everybody's doing
Yep.
something, the best strategy is to see, is not to stop them from
Yeah.
doing it, but to see if they can do it better.
Yep, yeah. Yeah, and we should be able to look at what those behaviors were of those kids. Okay. Good, you guys are going to keep us busy for the next few years.
Thank you, great talk. both as a researcher and as a parent of teens, thinking about it. I've been interested in some of you talked about sort of the family culture in a sense, or sort of family practices. And I've been interested in some of the sort of more, some of the interventions that have been done, say in college dorms or sororities. Carolyn Becker in Texas has done some of that work. And one of the things, to really think about the culture that's shaping the practices and the behavior. And one of the things that they do in that intervention is that they remove the scales from the sorority houses or from the college dorms. And I'm just curious, because from the one hand, in sort of all the conversations we're doing today, there's sort of a sense of self-monitoring that could be really important in terms of, and then at the same time, to what extent does that then lend itself to this weight focus that isn't sort of the healthy eating or the healthy body image? And I'm just curious what thoughts you have about this sort of the scale.
I have lots of thoughts. We talked about this at lunch also, whether the monitoring with the eating is really, if the monitoring causes the changes in eating patterns, or if people that actually are eating quote unquote better are better at monitoring, But in our research, first of all, I totally support Carolyn's work. They use a cognitive dissonance approach, and it has been found to be quite effective as a prevention for high-risk individuals in young adults. In our research, we have definitely found that weighing yourself frequently is not helpful over time and can be predictive of engagement in disordered eating behaviors. So I would definitely support not having regular weighing. Certainly, my advice to parents would be not to weigh your children. It's, I think it's fine if you're at a medical office, doing that. The adult literature actually does, to some degree, support self-weighing. And so there's definitely, you're talking about differences between adolescents and adults. I have not engaged in that research. It's coming kind of from a different camp. So I would say that there is some controversy around that issue. But certainly within the eating disorder field, the idea of not weighing yourself is strongly promoted. And I would say that within the adolescent obesity field, I would also probably not recommend regular self-weighing. Whoever has the mic, go ahead. You wanted to ask something else.
Yeah, I was just wondering, it sounds like we're partly asking a lot of the adolescents because as adults in our population, we have enough trouble with self-regulation, and they're up against a lot as adolescents that they're looking to probably the pictures on the magazines as much as the adults, if not more. So, is this like a tidal wave that we really can effectually have change in? And what do you think that looks like? Is it purely at the family level, or do you envision public health or public service announcements that are targeted toward the adolescents? Do we need to have magazines with sexy pictures and strawberries, or what's the direction that you would see us kind of heading in to affect change? Because they're making choices, but they're no better informed about how to make those choices than the adults are, and the adults can't figure it out really. So it's a real tough challenge. And
yeah,
wondering.
I definitely think that if we want to have an impact, we have to have change going on at different levels, at the family, school, and the environment. I actually believe that it is possible. I have seen it within my own social circles where people do not talk about dieting. At my work, in my group, no one would say I'm on a diet. Maybe they're doing it, maybe they're not being honest about it, but it is a different conversation, and I saw it with my kids also and with their friends. I really did see the change. Last week I was in London. I was invited by a member of parliament to speak on body image. They had a hearing. They have a national body confidence campaign. And this was a minister, granted a junior minister. I didn't know there are junior and senior ministers, but she's a minister in the government, and they had a group of people from government, and there were about 10 people from government and about 15 people who, mainly academics working in the area of body image, and they're really working toward change. So what are they doing? It's a drop in the bucket as compared to what's going on with regard to obesity, but it gives you some hope that some of these issues are being addressed. And one of the things we did was I showed them some posters that some obesity campaign. So I mean, you're talking about the media, and I mean it's a big answer, but we see obesity prevention campaigns that really stigmatize overweight people. And it's kind of like a media company comes in and says, you know, this is going to catch the eye of someone. That's something that we can prevent. We can really get out there and say, this doesn't help. That's why I think the data showing that this stuff actually doesn't help even with weight. It not only increases risk for disordered eating, but it increases risk for weight gain, can hopefully have some type of effect. The research that Rebecca Poole is doing at Yale at the Rudd Center, showing that these types of ads are actually perceived by people as less motivating than ads that only focus on behaviors. So those are some small things that we can be doing. I think it has to be happening at the family and the societal level. We have to change the conversation. You can make a vow to leave this room today and say, I'm not going to talk about my weight. If someone says to me, and this happens all the time, someone will say, you look great, did you lose weight? And like the national response is, no, I've been trying. I just say no. Or I say, no, did you think I needed to? They won't ask you again. Yeah.
Okay. Okay.
Oh,
I
sorry.
guess this is really fascinating data. And I guess what I've been sitting here trying to think about is what the developmental story is. So from what little I know about this research in adults, your data seem to parallel the adult literature very nicely, that dieting is maybe ineffective or less effective than people think it is. So do you, from your data, think that the reasons for the dieting in the first place, or the way the points of intervention that might be effective, differ between adolescents and adults? And I think you've kind of started to address that question by saying that maybe adolescents are more receptive to the family eating or things that are change in their behavior. But other than that, what are the developmental differences about what causes the behavior, what maintains it, and what's ineffective about it?
So the behavior being the dieting?
The dieting, right, yeah.
Okay, so my research has not focused on adults. So what might be the developmental differences in what's predicting the dieting?
So for instance, do adolescents versus adults think they're more likely to stick to the diet, for instance? Or is it coming from the motivation to do it, based on peer influence or something?
I mean, I would actually think that many of the predictors are similar.
Mm-hmm.
I mean, it's being overweight in a thin-oriented society, having a poor body image, issues of self-esteem, what's going on in society, the societal pressures. I mean, they might be stronger in adolescents, but they're also, and then, so I think a lot of those things are similar. I think that what you'll probably see is that the behaviors that the adolescents are going on tend to not be as healthy as the adults. So the unhealthy behaviors in the adolescents are probably less healthy than the unhealthy behaviors in the adults in general. Just as kind of, like general risk-taking in adolescence. Again, I'm not sure that I totally answered your question, but we can talk more.